You know, for the past several years, Dr. Sonia Spencer has been on the show talking about different ways that she's been able to help people with back problems, neck problems, fibromyalgia, carpal tunnel. The list goes on and on. Now you got the new Ultra Slim thing. And I'll be honest, I've never used her services up until a few months ago. And you may recall, it was on the news, my little accident where I got blindsided and I got hit on the passenger side of my truck, knocking my truck sideways. And when it did, my head snapped over to the right and damaged some ligaments in my neck. Who do I call? Dr. Spencer. And over a series of 5 weeks, went through treatment, and what a difference. But I was pretty messed up when I came in here.
You were, and most people who get in an accident are really traumatized because it does damage the muscles and ligaments that are supporting your head. If you think about how small this area is, and when you get hit like that, and how everything just shifts really fast, it's called whiplash for a reason.
Yeah.
Because those muscles, the ligaments, the nerves get severely stretched and damaged, and the spine misaligns and causes those pressure on those pain-sensitive nerves, and it takes a few weeks to get someone over that, sometimes a few months, depending on how severely they were damaged.
Now, you even took x-rays with me and everything, and you could see the a little bit of the curvature in my neck and everything, where it was kind of knocked out of whack there. And I mean, it was painful for me to turn my neck, either way, or either up and down, because of the damage that it had done. But came to you 2-3 times a week for 5-6 weeks, and just gradually worked me up to where now it's like I can go up and down, go sideways, and do all that, and But it's such a relief.
It really is such a relief, and barring a fracture, an auto accident is the most severe form of spinal injury that a person can sustain. And so many times patients come in and they say, I had an accident 10 years ago and I was never the same. So it's really important that people do like you did and come in and get the treatment that's appropriate for them, instead of just waiting for it to heal up on its own, because many times it doesn't, and it can cause long-term residual problems. And what we do with every patient that comes in is very similar to what we did with you, Jim. We measure how far they can turn and bend because we know what normal is. And if a person has lost the ability to move freely or move normally, we want to restore that normal motion and function of the spine so that it doesn't decay without the proper care. It doesn't cause arthritis or permanent damage to your disc or muscles, because all of those things, if they're not rehabilitated, they can be pain generators in the future. So congratulations on getting that treatment and getting the care you need.
Well, I have you and your wonderful staff to thank for it, because I mean, and I've got to really put praise on the staff too, because you've got such a great crew here. Each individual one, they worked with you in different areas. Whether it's doing the side to side thing to work with you. Plus, you give them you email them some exercises they can do at home, or even at your office, that can help you out during the day. Just really simple things to follow while you're sitting at your desk. Well, as far as moving your head, and they take measurements. And that was one of the other things, to where you want to get to 85-90% of your abilities before you're basically released.
That's right. We want to restore a person as much as possible back to their pre-injury status, how they felt prior to the accident, and the quality of life they had before they got injured.
Oh, I was in so much pain. I mean, the very first night after I had my accident, I couldn't sleep because I couldn't get my head set right in the pillow. I ended up sleeping in one way on my side. If I moved, it was just so much pain. But again, gradually, you helped ease that pain and get my neck back to where it was through several different adjustments.
Yes, we did corrective chiropractic adjustments on you, and we also did some cold laser therapy with you with the range of motion exercise. Right. We did some other therapies.
The TENS thing.
Yeah, to help relax your muscles. And so these are the things that we do to restore people. Let me ask you something, Jim. Was any part of the procedure painful to you that we did?
No, I mean, the great thing about it is they would have me, or your staff would do something to a point where you feel pressure and not go beyond that point, because they didn't want you to hurt yourself anymore or injure yourself any more than you needed to. So that's one of the wonderful things that I really liked about it. It was gradual. It wasn't like you're pushing yourself. Oh, you need to push it more. You need to push it more. It wasn't that way. And no, as far as that, not at all.
The reason I ask you that is because so many people tell me they waited so long to come because they were fearful that the treatment would hurt, and they're already in pain, you know. And that's what I hear about people who have automobile accidents, you know, that they go ahead and take the pills or whatever instead of getting, because they're afraid it's going to hurt more. And
all they're doing is masking the pain.
They're just masking the pain.
And I mean, that's what I always call a quick bandage. I mean, in the long run, as you said, if you don't get some kind of treatment down the line, it's just going to get worse, or to the point where you can't move at all. Then it's going to take a whole lot more to get you back to where you were. So, you know, yes, there was a little discomfort at times, but again, y'all didn't push it any further than my pain tolerance, kind of thing.
Right, and that's what I love about what we do with people. It's gentle, it's effective.
Definitely.
You know, we do everything we can to make our patients comfortable and take good care of them. And like you said, I have the best staff in the world. I hear it every day from patients who come in here, and because they all care about people just like I do. And I look for those people who can transmit that to people and help them heal.
Well, you know, as many times as we've done this show over the past several years, all the wonderful testimonials that I've heard from different people that have talked about how you've helped them with migraines, with neck pain, with back pain, and different things like that. And I always thought they were really great stories. And to be honest, I never thought I'd be one of those people sitting here telling my own little testimonial story about it. But oh yeah, definitely. You know, and if I got to hug your neck.
Oh, thank you.
It was so good. You and your staff. And hugs go out to the rest of the staff too, because they are so well.
And we love taking care of you too, Jim.
Well, I love it too. So, and I'll be back some more of the ultra slim thing going on here, so I can get some more inches off of this stomach, because I love that, how you can lose inches by just taking a nap.
We love taking care of you, Jim. And I tell you, if you're involved in an auto accident, come in and talk to me and have a consultation. We work great with attorneys and other healthcare providers to make sure that insurance, so that you can get the care you need and get back on your feet.
All right, Doc, thank you so much again.
You're welcome.
You've been in an accident, you need some help, you're having some pain, they can help you out here at Spencer Chiropractic in Gulfport.